Hi, I'm Dr. Hamid Sohrabi. I'm an associate professor of psychology at Murdoch University. Um, I'm going to give you some details about a project that we do here at Australian Alzheimer's Research Foundation. And that project is Western Australia Memory Study, or WAMS as we call it. The WAMS started in 1996, and we recruited individuals aged 60 and above, and then those without any dementia or history of strokes or any other clinical conditions that were not controlled properly. And we've been following these participants for a long time. And then in 2006 and again in 2013, we started new wave of recruitments, and we currently have about 350 individuals who are actively participating in VAMS. The reason that we do this longitudinal study is that we can collect samples of different markers for cognitive and memory related aging, and also we can find out that the changes over time will result to what consequences and what kind of diagnosis if there is any decline or any impairment. So the VAMS has been very successful in coming with new ideas, and one of them is developing a new measure for memory complaints. And then the measure is called McCusker Subjective Cognitive Impairment Inventory, or MACSI, and it has been tested on over 600 individuals. This is a measure that asks about how do you feel about your memory, has there been any changes in your memory over the past 2 years, and so on. And currently we are trying to validate this measure further in relation to actual biological markers like imaging and blood biomarkers related to Alzheimer's disease, and see if this questionnaire can predict the outcomes. Also, we have been very successful in developing our own sensory ability measures, and then finding the relationship between different senses and also future risk of dementia. One of them is the smell or olfactory test, and then we have come up for the first time here in WA with a measure of memory for smells. So that helps us to find out if there is any change in the smell function, and that change can predict future risk of dementia. Also, in collaboration with different groups, and specifically with Ear Science Institute here in Perth, we have been looking into the relationship between hearing loss and dementia. That has been a very well-received project in terms of the number of papers that we have published and also its scientific contribution. Something that I also want to mention, because it went very well received when, at the time, was the relationship between depression and dementia. And we noticed that people who show some signs and symptoms of dementia, but they're not clinically diagnosed with depression, they're actually at increased risk of developing Alzheimer's disease later in their life. So right now what we are trying to achieve is to validate the data that we have collected so far, specifically on measures of memory impairment and also olfactory memory and so on. And then we believe that the volunteers have been contributing to this work to a degree that without them our work wouldn't have been continuing or even getting close to these new measures as we have done so far.